Hello, Miss Pegram. How are you?
Good. How are you?
I'm good. My name is Shelby, and I'm going to be your nurse today. Can I see your wristband, please?
Yes.
Can you tell me your name and date of birth?
Lily Pigram, October 24, 2000.
Alrighty. I'm going to go ahead and perform hand hygiene. I'm going to be using alcohol sanitizer, antibacterial. But if I were washing my hands, I would do it for 15 seconds, rinse, and then dry it off. But this is good enough for now. Alright. So, I'm going to be doing a physical assessment on you today, and everything stays between us, it's confidential, and you have the right to refuse anything.
Okay.
Alright, so I'm going to begin by asking you a couple questions. Alright, what's your name?
Lily Pigram.
Where are you?
I'm in your dorm room.
Okay, and what year is it?
It is 2021.
Alright, so our patient is awake, alert, and oriented times 3. Alright, now I'm going to ask you to follow some verbal commands. Can you lift your left hand, please? And touch your nose. Okay, our patient can follow verbal commands, and her speech is appropriate for her age. Alright, I'm going to go ahead and start with your eyes, so you can take off your face shield. Alright, I'm going to assess the size of the pupils. And they are a size 5 right now. So I'm going to go ahead and dim the lights and check her pupillary light reflex. Right eye constricted, left eye constricted. Okay. Alright, I want you to look at that wall over there and follow my pen light all the way to your nose. Okay, and both of her pupils converged, so her pupils are equal, round, and reactive to light and accommodation. So now we're going to go ahead and do the Snellen chart. Okay. Alright, so can I get you to walk over here to the door? And while we're doing this, I'm evaluating her gait. Her gait is steady. Alright, and this isn't the normal 20 feet that you would do, and this isn't the normal chart either, but this is improvisation. So I want you to read the lines as I point to them with both eyes first.
Okay. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, E, O, P, E, Z, O, L, C, E, T, D.
Okay, now can you cover your right eye?
Yes.
Okay.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, P, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, E, O, P, E, Z, O, L, C, E, T, D.
Okay, now can you cover your left eye?
Yes. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, E, O, and P, E, Z, O, L, C, E, T, D.
Okay, so her eyes are a 20-10 together, and a 20-10 in the right, and a 20-10 in the left. So you can go ahead and come back and sit down for me. Alright, we're going to move on, and we're going to do the ears now. So I'm checking for symmetry, and they do look symmetrical, and they line up with the outer canthus of the eye. There are no abnormalities or lesions on the ears. Her Darwin's tubercles are present on both sides. Alright, now I'm going to do your nose, so you can go ahead and pull your mask down. So I'm looking for symmetry and any external skin characteristics. I'm not seeing any lesions or lumps or other deformities. So now you can go ahead and tilt your head back. And I'm looking for the turbinates, and they are present, and they are equal bilaterally, and they are pink and moist. Alright, now I'm going to be doing the mouth. So you can go ahead and open your mouth for me. I'm going to begin by looking at the buccal mucosa, and it is pink and moist, and the top palate is also pink and moist, not having any lesions. Can you stick your tongue out for me? The tongue is pink and moist and midline. Can you raise your tongue for me? The frenulum is intact, and the skin below the tongue is pink and moist with no lesions. Now I'm going to look at the teeth. The teeth are white, they're clean, there are no teeth missing, and there appear to be no dental caries. The gums are also pink and moist. And now if you'll go ahead and say ah.
Ah.
All right, her uvula rose upon phonation, and it's also midline. And her tonsils are present, and they are a 1, a grade of 1. Okay, and the skin back there looks pink and moist. And then the bottom palate is also pink and moist. All right, can I test your gag reflex?
No, ma'am.
Okay, if I were to test her gag reflex, I would use a tongue blade and put it on the back of the tongue and push down. All right, so now that we're done with the mouth, we're going to move on to the neck. Okay, so we're checking the symmetry of the neck, looking for any outer skin characteristics. There seem to be no deformities, there's no lumps. I'm also looking for pulsations in the neck. There are none on the left side, and there are none on the right side. So now I'm going to go ahead and palpate the carotids. You do these one at a time. This is her left carotid, and it is a 2+ with no thrill. And for her right carotid, 2+ with no thrill. Now I'm going to auscultate for any carotid bruise using the bell of my stethoscope. All right, and do the right first. No carotid bruise on the right. And no carotid bruise on the left. So that is all for the neck, and now we're going to move on to the posterior chest. So if you will, turn to the side for me with your back facing me. And I'm going to go ahead and lift your shirt up if that's okay.
Yes.
Okay. So we're going to begin by inspecting the back, looking at the skin. There appears to be no lesions, lumps, or deformities. She has a couple red spots here and there, but nothing major. Lower back looks great. And the scapulas look symmetrical, the shoulders look symmetrical. So now I'm going to go ahead and palpate for tenderness. Let me know if anything feels tender. Okay, there's no tenderness reported. Now I'm going to go ahead and percuss her CVAs for any tenderness, and this is looking for any kidney problems. So I'm going to do it just like this. Let me know if it hurts. All right, and there is no CVA tenderness present. And now I'm going to go ahead and auscultate the breath sounds of the posterior chest. Oh, wrong side. All right, and I'm going to begin in the left epices of the lung, making sure I have my diaphragm on. All right, will you take a deep breath for me? And again. All right, there were no adventitious sounds present in the posterior chest, and the breaths were even and unlabored in all of the areas. All right, and now we're going to go ahead and do the anterior chest. And I'm gonna begin by first watching your respirations, looking for your respiration rate and your symmetry, rise and fall. So I'll do 1 minute. All right, her respiratory rate was 14, and the chest rose and fell symmetrically, and the respirations were even and unlabored. So next we're going to go ahead and inspect the anterior chest. I'm going to move your shirt out of the way if that's okay, just so I can see everything. Okay, the skin color is appropriate for the ethnicity. There are no lesions or lumps or any other type of deformities. She has one freckle in the center though. All right, so now we're going to go ahead and auscultate her breath sound on the anterior chest. Once again, going to begin in the left epiphyses. Deep breath for me. I'm going to go up under here. Okay. There are no adventitious sounds present. So now I'm going to go ahead and do the heart sounds. All right. I'm going to be beginning with the aortic, which can be found at the second intercostal space to the right of the sternal border. S1 and S2 are present and audible with no abnormalities in rate or rhythm. And now we're going to do pulmonic, which is also found at the second intercostal space, but it's to the left of the sternal border. Strong heartbeat. S1 and S2 are heard with no abnormalities in rate or rhythm. Next is going to be the tricuspid, and it can be found at the fifth intercostal space, just to the left of the lower sternal border. So I'm going to go right here, if that's okay. It's more up in the center. I just don't want to invade her privacy too much. Alright, the tricuspid is audible S1 and S2 with no abnormalities in rate or rhythm. Now we're going to do the mitral. S1 and S2 are present with no abnormalities in rate or rhythm. And while I'm here, since the mitral and the apical are the same area, I'm going to go ahead and do the apical pulse for 1 minute. Okay, her apical pulse was a 90 and with no irregular rate or rhythm. And now I'm gonna flip and use my bell to auscultate for any extra heart sounds such as a murmur. And once again, mitral or apical. S1 and S2 with no extra heart sounds or murmurs. All right, now I'm going to do the tricuspid. S1 and S2 with no extra heart sounds or murmurs. Now I'm going to do the pulmonic. No extra heart sounds or murmurs. And then aortic. No extra heart sounds or murmurs there. Alright, so now that we are done with your anterior chest, we're going to move on to doing some of the upper extremities. So I want you to reach out and grasp my fingers as hard as you can. Okay, so the strength in the hands is a 5. And just another test that we can do, I'm going to grip your fingers and pull them apart against my resistance. Good strength in the hands and fingers, so it's a 5. And so now I want you to hold your arms out like this, and I'm going to grab them right here. I want you to push against me, and then pull against me. And now I'm going to do your shoulders. Okay, so the arms and the shoulders strength is 5 out of 5. So now I'm going to go ahead and palpate your radial pulses. Okay. And those are a 2+ bilaterally with no thrill. And now I'm going to palpate your brachial pulses. Also a 2+ bilaterally with no thrill. Now I'm going to move on to some capillary refill in your fingers. Okay, less than 3 seconds in all fingers bilaterally. Now we're going to do some range of motion of the fingers. So I want you to wiggle them, separate them. Full range of motion with no difficulties in the fingers. And can you do your hands for me? Go down, up, down, and up. Full range of motion in the hands. And then a little more with the wrist. Go down, up, down. Okay, and the wrist, full range of motion with no limitations. And now we're going to do the elbows, the elbow joint. So I want you to flex and extend, flex and extend. So that's full range of motion in the elbows with no limitations. And now you can go ahead and stand up and we'll do your shoulders. So go up, go back, side, and back. Alright, full range of motion in the shoulders with no limitations. And now I'm going to go ahead and get her to lay down on the bed. And we're going to do some abdominal inspection. Okay, can I lift your shirt up? Okay. Alright, so I'm going to get my pen light and I'm going to begin by inspecting the abdomen. And it is symmetrical. The contour is flat. The umbilicus is inverted with no herniations and no deformities or lesions inside. And we're looking for any pulsations with the pen light. And there are none present. Alright, we're looking at the skin characteristics. I see she has one freckle right here that's very prominent. But other than that, she has no deformities or skin lesions or abrasions on her abdomen. So now I'm going to go ahead and auscultate the vowel sounds, beginning in the right lower quadrant, using the diaphragm. Normoactive in the right lower quadrant. All right, right upper quadrant. Normoactive. All right, and then left upper quadrant. Present, normoactive. And then left lower quadrant. Present and normoactive. Alright, so all of her vowel sounds are present and they are normoactive. So now I'm going to go ahead and do some light palpation, beginning with light. I'm going to do some light palpation and then move on to deep, but I'm going to do light first, going 1 centimeter deep. In the right lower quadrant first. Is that tender?
No.
Alright, there's no tenderness or masses. Now we're going to do the right upper quadrant. No tenderness or masses. Left upper quadrant. No tenderness or masses. And then left lower quadrant. No tenderness or masses. Alright, now I'm going to do some deep palpation. Alright, and this is going a little bit deeper, about 5 to 8 centimeters. No tenderness or masses in the right lower quadrant. No tenderness or masses in the right upper quadrant. No tenderness or masses in the left upper quadrant. No tenderness or masses in the left lower quadrant. Alright, so that concludes the abdomen, and I'm going to ask you, can I palpate your femoral pulse?
No.
Alright, the patient has refused this, but if I were to do it, I would palpate on the groin area of the inner thigh for 1 minute and report the pulse rate. Alright, so now we're going to do some range of motion in the hips while I have you laying here. So if you will take your left leg and go towards me, okay, and back to there, and then the other leg towards the wall and back. Range of motion is full with adduction and abduction of the hips. Now I want you to go up with your left leg and down, up with your right leg and down. Full range of motion as far as going up and down in the hips, so that's great. And now while she's while she's laying down, we're going to go ahead and inspect the legs. Alright, looking at the skin characteristics. There appears to be no lesions or deformities or lumps, especially in the knee joint. Everything looks good there. And I'm looking for hair distribution, and she has no hair distribution on the legs. She has no varicose veins. Alright, that's great. Now I'm going to go ahead and palpate over the tibia for edema. Okay, there's no edema in the left leg, so that'd be a 0. And no edema in the right leg, so that'd be a 0. And I'm also feeling for warmth. Her skin feels really warm. Alright, now if you want to go ahead and get down off the bed and come sit over here. I'm going to do your lower extremity pulses, starting with your popliteal. Two plus bilaterally with no thrill. And then posterior tibial. 2 plus bilaterally with no thrill. And then dorsalis pedis going up from the second toe. Two plus bilaterally with no thrill. And now we're going to go ahead and inspect the toes. Let me get my pen light. Wherever it went. I appear to have lost my pen light, but it's okay, we don't need it. Alright, we're going to inspect the feet, looking for any skin characteristics or lesions. There are none present. We're also looking at the bottom of the feet. No wounds or lesions. The skin is an appropriate color. Same for the right. Okay. And now we're going to look in between the toes. No dryness or cracks. And now we are going to get the capillary refill in the toes. Capillary refill is less than 3 seconds in all toes on both feet. Alright, and now we're going to do some range of motion with the feet. Okay, so, well, this one's going to be against resistance. I want you to push up and then push down like you're pressing the gas. Alright, and I'm going to check your legs too while I'm here. I want you to push toward me. Okay, and back towards you. Okay, great. And now I want you to go ahead and flex your knees. I want you to do your left knee and then back as far as you can go. Right knee and then back as far as you can go. Alright, and wiggle your toes for me. Full range of motion with no limitations in the toes. We check the feet. Full range of motion with no limitations. And the ankles, can you invert for me? And then outward. Full range of motion in the ankles. And we have checked the knees. And we done the hips earlier. So now we are ready to do some spinal range of motion. So you can go ahead and stand up for me. Go forwards, backwards, and side to side. Full range of motion with no limitations in the spine. And now I'm going to go ahead and do a scoliosis test. So if you will, bend over and touch that chair. I'm going to lift your shirt. And we're going to be palpating the spine, looking for an even spine. And the shoulders appear to be symmetrical. One's not higher than the other. The hips are in alignment. And overall, there appears to be no scoliosis in my patient.